immunization access for kids. I'm Jill Horner. This is Comcast Newsmakers. With me is Pennsylvania State Representative Seth Grove. Thanks so much for being with us.
Always great to be on.
Let's talk a little bit about how kids currently get vaccinated for the flu, for example, or pertussis. Do they have to go to their doctor's office?
Yep, it's the only place you can get immunized is a doctor's office. Only nurses and doctors can actually give immunizations in the state of Pennsylvania. 36 other states do allow pharmacists to immunize children. Anybody under the age of 18. Currently in Pennsylvania, pharmacists can immunize adults, anybody 18 and over. So by expanding the access, you expand the ability for kids and parents, choices for parents to get their kids immunized and not lock them into that tight-knit box.
And when we talk about immunizations, are we talking about expanding access to all immunizations when it comes to a pharmacist? Because over the course of a child's life, they do receive many different vaccines.
Yeah, all of them would be administered to them. Pharmacists are currently educated. They have all the safety precautions already needed to be able to do that. Obviously, some vaccinations do require a prescription. Some are at home. So if you have a parent maybe for the first time trying to give their child an immunization, they can't get a doctor's appointment, they can go into the pharmacy and actually have the pharmacist help them do it. Because it's not an easy thing to give a kid a shot. I mean, I couldn't even imagine stabbing my own kid in the arm with a shot and stuff like that. So
and having them stand still.
Exactly. It's not a normal thing to do. So having a trained professional with 12, 13 hours of access to go and help administer those vaccinations is a good thing for parents and kids.
You mentioned that in the Commonwealth, pharmacists can already administer vaccinations to adults. Would they require additional training to do this for kids?
Nope. Ironically, they are trained for kids too. So our pharmacy schools in Pennsylvania nationally train pharmacists to do birth to as old as it gets. They're already trained to do that. There's already precautions put in place. They have to have CPR trained. They have to be trained in how to utilize an EpiPen just in case there's an adverse reaction and stuff like that. So they're trained to do all that already. It's just the law doesn't allow them to do it.
And let's focus on what this could actually mean for school-age children. Children are required to have certain vaccinations in order to attend school.
Yeah.
Could this help with that?
Yeah. Last year, there was a new requirement for 7th graders to get pertussis vaccinations. The Department of Health had to delay that hard deadline twice because kids just weren't getting the immunization. Schools did a great job of getting it out there, but it was just an access. They created a log jam because you had to go to your doctor, you had to get an appointment, you had to go in and get it, where you could have just stopped by your pharmacy and gotten the vaccination.
So that's just one example. It could potentially have an impact on the flu shot too.
Yeah, you talk about, as a parent, when we take our kids to the doctor, there's a sick kid side and a non-sick kid side. When the flu is going around, do you necessarily want to take your kids into that environment to get a flu shot, or do you want to go to a pharmacy where there's going to be less sick people to actually infect the kids to get their vaccination?
And this is House Bill 776 that we've been discussing. You say it could have an impact on military families too? Yeah,
unfortunately, currently TRICARE, which is the health insurance coverage for military families, they have their immunization coverage under their pharmacy benefit instead of their medical benefit. So for a military family to actually access their coverage they have and not have to pay for the vaccination, they have to go to a pharmacy. Well, it's great for the parents, but their kids, unfortunately, they have to go set a doctor, they have to go pay the copay and then get a vaccination. And they still have to pay for the vaccination on top of that. So it would really help our military families.
Thanks for being with us.
No problem. Thank you.
We've been talking with Pennsylvania State Representative Seth Grove. I'm Jill Horner.